dear Chair. Let me tell you about my 6 months progress on my PhD topic, which is the comparison of contraceptive methods and the route of administration. I'm Gábor Vleskó, and I work as a specialist doctor at the Department of Obstetrics and Gynecology at the Semmelweis University. My vision is to expand knowledge on contraception in the world so that every woman can avoid unwanted pregnancy. And the mission is to find new information that can help a wide population of women to choose the best option. You can see my project list here. The first project is about investigating parenteral and oral contraceptive methods, and the second one is investigating the role of obesity on hormonal contraceptives. So investigating the efficacy and safety of combined parenteral and oral contraceptives in reproductive aged women. We know that there's almost 2 billion women worldwide of reproductive age, and over 150 million use contraceptive pills. So there's still space for other contraceptive methods. We also know that the effectiveness of a contraceptive method highly depends on the compliance of the method. And there were randomized trials where they find that every second women were likely to miss up to 3 pills of a cycle. So our aim is to investigate the efficacy, the cycle control, the compliance, and the adverse events associated with these parenteral contraceptive methods. The clinical question is that are these combined parenteral contraceptive methods as effective as the oral contraceptives? As a population, we had the women of reproductive age. The intervention was the transdermal patch and the vaginal ring versus the combined oral contraceptives. As outcomes, first we had the Pearl Index, which means efficacy, and the secondary outcomes we measured compliance, adverse events, and safety. The hypothesis was that the parenteral administration of these hormones is a preferable route to oral. It might be more effective and associated with fewer side effects. We performed a systematic search on the 3 main databases, and with the following search claim, we were concentrating only on randomized controlled trials. And after the duplicate removal, we had around 2,500 records, and at the end, we had 14 eligible full texts. Let me tell you about the results. This was a primary outcome, the Pearl Index. The Pearl Index is a number. Theoretically, it's between 0 and 100, but the lower number means the better contraceptive efficacy. 0 never happens, and also 80 is when no contraceptive is used at all. We can see, perform the subgroup analysis as well, and we can see that the outcome measure was mean difference, and we can say that there was no difference between the parenteral methods and the oral ways. It has a clinical relevance that we can encourage people using new methods because it has the same efficacy as the trusted oral contraceptives. We also checked compliance, and compliance has a high clinical relevance because if the compliance is better, the stress of the women is lower, of course, so they trust the method more. And we found that in case of the patch, the measure of outcome was odds ratio, and we found that the odds ratio was 2.3, which means that with the patch, the compliance was over 2 times better than with oral contraceptives, and this was also mathematically a significant result. So we can say that with the same efficacy, we can offer other contraceptive methods than the oral tablets, the traditional ones, with a better compliance. We checked adverse events, and we had some interesting ones like breast discomfort. we found that there's a higher risk of developing breast discomfort in case of a patch, which means to us it was also mathematically significant, but the clinical relevance is that we have to personalize the contraceptive use, and we always have to check the patient needs and preparations. There's another adverse event, vaginal discharge. We also had a highly mathematically and clinically significant result. If a vaginal ring is used, there's 2 times more likely to have a vaginal discharge. It means we have to tell patients that they must know this before using these methods. The strengths of our meta-analysis is that these were all randomized control trials, and this was a comprehensive analysis of the different administration methods. We had some limitations, like we performed the subgroup analysis because we had no direct ring versus patch comparison, and there's no uniform way to report compliance and adverse events. So as a conclusion, we can say that the contraceptive efficacy is the same regardless the way of administration, but a personalized choice can be offered to patients based on different side effect characteristics and patient preferences. The implication for practice is this, the personalized contraceptive use, and we try to give patients a method which comes with a better compliance and lower stress level. The implication for research should be we should try different drugs. We should do the direct comparison of the different application forms, so the ring versus the transdermal patch. And also we can try to develop other parenteral administration forms as well. The other topic is investigating the role of obesity and hormonal contraceptives. We know that it's predicted that by the end of the decade, 1 in every 5 women will be living with obesity. And we think that the increased body weight might change the metabolic processes. This way, the contraceptive efficacy might be affected, and also the adverse event incidents like thromboembolism and others. Our aim is to investigate the efficacy and the side effect profile of contraceptive methods in overweight and obese women. The question is that are these contraceptive methods less effective in overweight women and women with obesity? As a population, we had the same women of reproductive age, and we compared BMI over 25 with normal BMI, and the primary outcome would be pregnancy, and the secondary outcome we measure adverse events. And the hypothesis is that hormonal contraceptive methods are less effective in overweight women due to the altered pharmacokinetics. So the clinical and research implication would be that we should try a good and safe contraceptive method for women with elevated body mass index. We performed a preliminary research with the following search key, and we found almost 5,000 records. So we know that this topic is feasible and the Prospero registration is in progress. As a summary, we are planning to submit both studies in July, this summer, so July. And I would like to thank you for your attention with the quote of William Osler, that medicine is a science of uncertainty and the art of probability.
Congratulations for your presentation. I would like to ask a question regarding your first topic. So I was just wondering that can you use this patch and ring method in every patient, or can you use it in every patient, or are there any contraindications maybe?
Well, we can use in every patient. Well, it only depends on the patient's preferences. And I think that the younger the patient is, the more likely to use a modern method, and they trust it better. They have no fear of trying other things. Some patients who has other problems maybe might have a fear from inserting something into the vagina which stays there for 20 days, or have a fear of maybe the partner will feel it and that might cause some problems. But otherwise, there's no contraindication.
Thank you.
Other than the orals.
Thank you. Brilliant presentation. And I would like to ask that isn't it too risky to give birth control to overweight people? Because as far as I know, it's not customary to give it to them.
Well, thank you for the nice question. Yeah, it is. It's widespread. We don't really like to give obese patients contraceptive pills. But I think that in this case, we only think about the short-term risk. So we don't give a medicine because we don't want these adverse events to happen next week. But I think if we don't give a medicine, we just pass the risks to other colleagues, because morbidly obese women getting pregnant might have a huge risk at an interruption or having an abortion, or if the pregnancy goes on, then the pregnancy itself has a huge risk with obesity. Like they can develop diabetes, and at the end the cesarean section has a huge risk. So if we compare these, then maybe, and that's what we want to check in my next project, so that maybe it's still more safe to give the pill, and then we can make these other complications lower.
Thank you. I would like to ask, what is the situation in Hungary regarding the oral contraceptive methods? How could we make more popular for the patients the combined methods? What do you think?
The parenteral methods.
The parenteral methods, yes.
Well, what is very useful, I think, if we have demo products. So personally, I have a ring at my office, so I can show them how it looks like. If we have, if you take the time to tell patients how it works and to encourage them, sometimes the fear is that they can't use it for themselves, so they always ask if it's the gynecologist who have to apply this. But if we take the time and we show them how exactly they look like, or we tell them some data about the transdermal patch, that when we calm them, that it won't come up, that it won't come down, and you can also go do sports with this, and even a swimming pool won't affect it, then I think it's a good way to make these more popular. Sorry for saying that, but some young women are really living a fast life, so they just they tend to miss pills. So at night they leave the pill home, they go to a party. So this won't happen with a ring, which is there for 21 days. So if you tell them that it's easier for them not to forget, maybe this will also help.